pasukan berganding tangan meningkatkan taraf kesihatan secara profesional.
Assalamualaikum and very good morning to all learners and viewers. I am Assistant Medical Officer Nick Abdul Mohamed from Health District Office Kota Bharu, and I am one of the facilitator for our Health District Office Basic Life Support Team. Today I am going to teach on how we can manage and rescuing an adult choking victim that is still conscious. To help me teach this topic better, I am going to use PowerPoint slide presentation on theory of how we can manage and rescuing an adult conscious choking victim. I am going to discuss and explain the slide one by one, and maybe I am going to show some example of the step and theory. Before we going further into the discussion on how we can manage and helping adult foreign body obstruction in conscious victim, I would like to ask one question to all viewers and learners. Have any of us encountering any choking victim before? Choking can be happen in any place or any time, especially when you going out for eating or doing any others outdoor and indoor activities. Choking is a life-threatening condition, especially when the foreign body is fully obstructing the victim airway tracts. If the victim left unattended and no help delivered to the victim to expel out the foreign body from his or her airways, the victim may become unconscious and death may occur due to asphyxiation. Next, let us look to the slide about the adult foreign body algorithm. This algorithm is important because it shows how we can manage the victim with foreign body obstruction and how we can assess the victim. First of all, you may see we need to assess the severity of the foreign body when we encountering the victims. There are two types of severity that you may observe from the situations. As you may observe, for the mild airway obstruction, that victim may still have an effective cough, and in severe airway obstruction, the victim already developed ineffective cough. When you encountering mild airway obstruction choking victim, try not to interrupt them, but you may try to encourage the victim to continue cough, and the victim will attempt to expel the foreign body by themselves. Otherwise, if you observe the victim have ineffective cough in severe airway obstruction, you may proceed straight to the step of rescue that victim. If the victim still conscious, you will proceed to the step of 5 back blows and 5 abdominal thrusts. 5 back blows and 5 abdominal thrusts is considered one complete cycle of rescuing step for a conscious adult choking victim. There are also special skills where the victim become unconscious, that is cardiopulmonary resuscitation or CPR. It is essential to the rescuer to take note about what is the common factors in choking. As for the information, choking happens when there is a foreign body in a victim airways. These foreign bodies block the air from outside from entering the victim respiratory tracts. This obstruction may consist of large piece of food, alcohol, and dentures in elderly. Usually, the choking condition occurs when victim is eating or drinking alcohol. In rescuing a choking victim, the rescuer must know how to recognize if the victim really have a choking situation or other situation. Do not confuse the situation of choking with other situations such as heart attack, seizure, or other condition that may cause sudden respiratory distress, cyanosis, or loss of consciousness. To better recognize this situation of choking, you must always remember the universal sign of choking is the victim will clutch the neck with thumb and fingers and attempt to cough out the foreign bodies. As I mentioned earlier, there are two classifications of foreign bodies in an adult choking conscious victim. As for the mild airway obstruction, or airway is partially obstructed and not fully blocked, the victim may still able to speak and have a forceful cough that is very effective to expel out the foreign body. That's why I have mentioned we must not interrupt if the victim still have an effective cough. And other sign of mild airway obstruction is the patient still able to breathe, and we may observe the victim still have good oxygenation where there is no blueness of the skin epidermis and other sign of hypoxia. Otherwise, in the severe airway obstructed victim, where the victim need immediate action from the rescuer, that is 5 back blows and 5 abdominal thrusts, the victim is already have total airway obstruction and there is bad oxygenation to the victim body. The rescuer may observe the victim have the sign of hypoxia where the victim is unable to speak and have silent cough. Increasing of respiratory distress may be observed when the patient have a very high respiration rates, and you may also observe the blueness of that victim skin epidermis due to the cell oxygenation deprived. Now let me highlight once more on how we can manage an adult choking conscious victim. If the victim have mild airway obstruction, do not interfere but encourage the victim to continue cough and attempt to expel the foreign body from their throat or wherever the foreign body is in their airway by themselves. Continue to check for deteriorations of the victim and observe the victim cough. Is it still effective or ineffective? Next, for the severe airway obstructed choking victim, you may straight away perform 5 back blows and 5 abdominal thrusts or Heimlich maneuver to the victims. After asking for victim permission and tell a bit about what are you going to perform to the victims. Remember, if you encountering a late pregnancy victims, you must not perform Heimlich maneuver to the victim because the pressure may dangerous to the fetus of that victims. So, how can we decide when to switch between the 5 back blows and 5 abdominal thrusts? As for the informations, after completing 5 back blows to the victim and reassess the victim's condition and the foreign body, the rescuer may straight away proceed to the 5 abdominal thrust or Heimlich maneuver for the victims. The cycle of 5 back blows and 5 abdominal thrusts will be continuous until the foreign body is fully expelled or dislodged from the victim airways, or until the victim become unconscious, where the rescuer will perform the skill of unconscious adult choking victim, that is CPR or cardiopulmonary resuscitations. There is also one special consideration when you encountering a very big victim or very obese victim, where your hand cannot fully grasp the victim abdomen, or you cannot reach the victim chest, then you as the rescuer may help the victim doing safe Heimlich maneuver, or you may perform the abdominal thrust to that victim while the victim lay flat on a solid floor. Now let us observe this slide about the back blows. The principle and concept of back blows is that we want to use our heel of hand to apply 5 precise and quick blows to the victim back, and the location of the blows is between the shoulder blades of the victims. And this slide is about the management of choking by performing Heimlich maneuvers. As you can see in the picture, first of all, to perform Heimlich maneuver, the rescuer will position his body behind the victim bodies, and the rescuer legs are put between the victim legs. This is to stabilize both victim and rescuer bodies, and the rescuer will make a fist and to put the fist at the exact location to deliver the abdominal thrust. The knuckle of the thumb will be put between the victim umbilicus or belly button and the victim rib cage or xiphoid process. After that, grabs the fist, and now the rescuer are ready to deliver the thrust to that victim abdomen. The concept of Heimlich maneuvers is to deliver a thrust to the victim diaphragm, and the diaphragm will force the foreign body out from the victim throat or airways. Finally, let me explain and highlight once more about how we can perform rescue step to a very big victim via self-Heimlich maneuvers. As you may observe from the picture, because we as the rescuer cannot fully grasp the victim abdomen, or we cannot fully reach the victim chest, then we may use a chair to help deliver abdominal thrust to that victims. The principle of self-Heimlich maneuver is still the same to the Heimlich maneuver performed by the rescuer, where the rescuer hand and fist are replaced by the chair. In rescuing the victim with late pregnancy stage, the rescuer may also perform chest thrust to the victim because this is less dangerous to the fetus compared to the abdominal thrust. Now, let's say you have successfully helped the victim expel out or dislodge the foreign body from his or her airways. For rescuer information, it is vital to stay with the victim after the rescue process is complete. This is because the victim may still in trauma situation and may develop the situation of anxiety, and the victim may become stressed. After the rescue process too, the victim need further medical attention and secondary survey such as X-ray, physical examination, and others to ensure that there is no complication from the foreign body obstruction earlier. To close our lesson for today, let me give one advice to all viewers, learners, and rescuer to keep the victim calm. First, we as the rescuer must keep ourselves calm. Thank you. Until we meet again in another lesson.